The Law and You, a look at laws in St. Vincent and the Grenadines which affect our daily lives. The Law and You, presented by lawyer panel P.R Campbell QC and brought to you on SVG-TV as a public service.
Ladies and gentlemen, brothers and sisters, boys and girls, greetings. Welcome to another presentation in this public service nation building series, The Law and You. This is program number 967, coming to you on Monday the 23rd of March 2020. On this program, I will speak to you on the topic Challenges from COVID-19. But before getting into the topic, as usual, my deepest condolences to all families which have suffered recent bereavements, and in particular the family of my two most senior law clerks in my office, Mrs. Ethel Raggy Stevens and Mrs. Marcel Foyle, whose brother was laid to rest last week, Friday. Sorry that I did not attend the funeral because I have decided to heed the advice of local, regional, and foreign doctors against being involved in large crowds. Second preliminary, on behalf of the Spiritual Baptist Archdiocese of St. Vincent and the Grenadines, and in particular on behalf of His Eminence Archbishop Melford Pompey, I would like to advise all those who belong to our Archdiocese that the leading events we had planned for the next 2 or 3 months have all been cancelled. So the fun day we were planning has been cancelled. The pilgrimage to Canouan has been cancelled. The march we were planning for National Spiritual Baptist Day on the 24th of May, that has been cancelled as well. And at the consultation meeting, which will take place this week, Thursday, some official from the Ministry of Health would be coming to speak to us, give us a comprehensive briefing on the steps we should take to safeguard ourselves and our loved ones from the ravages of the COVID-19 virus. So that is Thursday morning at the St. John Spiritual Baptist Christian Pilgrim Church at Sion Hill. That event begins as usual at 9 o'clock. And we will have a comprehensive lecture about what we should do to comply with all the advice which has been tendered and is still being tendered in the face of this global pandemic. For National Spiritual Baptist Day, when the time comes, nearer the time, we will decide what advice to give to the individual churches, whether each church should have its own service or whether there'll be some other form of commemoration. But the national march, followed by the service which had been planned for Calico and the community college grounds, has been put off. I am going to devote this program towards highlighting the information which the authorities have publicized by way of advice to the citizens of this country. I will do so with minimal commentary. I will read you the guidelines issued by Cabinet after its meeting of the 19th of March, and I will also read to you the guidelines issued by the Ministry of Health. Now, in the lifetime of anyone who is alive, there has not been a pandemic as serious as COVID-19. Yes, in recent times we have had outbreaks of various things, Ebola and SARS and so on, but nothing to match COVID-19. It is a pandemic of biblical proportions, and some people refer to it as a plague. They may well be right. And ironically, in recent weeks, we have had swarms of locusts devastating the fields of countries in East Africa. And therefore, some people see these things as signs from above of the end of time. We've been warned of various things, wars, rumors of wars, diverse earthquakes in places, and pestilences, and swarms of locusts. Well, we're having the locusts, and we're now certainly having a pestilence. Every morning you wake up and you listen to the international news, you're hearing of larger and larger numbers of people in various countries of the world who are infected with this virus and who have died. There was a time when in the United States, very recently, it was just the state of Washington, that is not the Washington, D.C., Washington way out on the West Coast, that we were hearing had a problem. Now, it's the whole of the United States of America, with New York State and New York City being described up to this morning on CNN as the epicenter of the outbreak in the United States of America. In China, where this virus originated, they have fortunately indicated that there is a slowdown in the rate of infections. But interestingly enough, today on the internet, I pulled off a story from News 784, which says, China, leading doctor warns of a new coronavirus outbreak. So the article went on to say that the leading doctor, one of the leading top coronavirus experts in China, is warning that they are likely to have a fresh outbreak. Heaven forbid. But let me get right into the releases officially published by the government of this country. And let me say that this is the time for our leaders in government and in opposition to conduct themselves with responsibility, with maturity, and with full cooperation. This is not the time for politicking. The lives of many hundreds of persons of the nation are potentially at stake. So this is a time for our political leaders to demonstrate a collective approach to these things. And I personally hope that the government, the Prime Minister, has been keeping the leader of the opposition informed of various developments. And I hope that there would be responsible utterances from both sides. But this is what we have from the Cabinet. It said, on Thursday, 19th March 2020, Cabinet considered recommendations from the Ministry of Health, Wellness and the Environment and took the following decisions. 1. Approval was granted to maintain the status quo as it relates to travelers from the undermentioned countries who will be quarantined for 14 days: Iran, China, South Korea, Italy. In addition, all persons arriving from the following countries are required to self-quarantine for 14 days: United States of America, United Kingdom, European Union member countries. This will take effect from Monday, 23rd March 2020 from 6 a.m. All persons with a travel history, including countries not listed above, will be allowed entry once no symptom of the COVID-19 virus are exhibited. Upon entering this country, all persons will be issued with a card containing the COVID-19 hotline number and indicating that they are required by law to report any symptom of the COVID-19 virus which may develop after entry and during their stay in this country. If symptoms prepared, the affected persons will be isolated and tested. Social distances is recommended for members of the household of any person under quarantine. The government, having consulted with various stakeholders and in the context of the circumstances, advises that activities for the Bequia Easter Regatta and the Union Island Easter Festival will be cancelled. The government reminds all interested persons that the airports and the seaports of St. Vincent Grenadines remain open and protocols as enumerated officially will apply. And finally, under the existing laws, the relevant officials are authorized in special circumstances to take other health or security measures as may be deemed necessary. Well, I start by saying 1, but you didn't hear any 2, 3, 4, because the document they have, every paragraph is numbered 1. I think somebody made a bit of a slip up here. There are 1, 2, 3, 4, 5, 6 paragraphs, and all are numbered 1. Okay, and then this morning I saw on the computer this release from the Ministry of Health. The heading is SVG Weddings, Funerals and Church Services Limited to 25 persons. And the text reads as follows. The COVID-19 disease has spread around the globe to the Caribbean, including St. Vincent and the Grenadines, where there is still only 1 confirmed case. In order to reduce the likelihood of further spread within St. Vincent and the Grenadines, WHO has recommended social distancing. Social distancing is a non-medical tactic used to keep people physically apart from each other, as close contact helps to spread the virus. Social distancing is particularly important to prevent the spread of COVID-19 because there is no vaccine to protect against the virus which causes this disease. Therefore, the Ministry of Health, Wellness and the Environment issues the following advisory to faith leaders, event organizers, and the general public. Faith leaders are asked to be socially, culturally, and spiritually flexible at this time and be proactive to protect themselves and their congregations. The following measures are advised. 1. As far as is possible, reduce the number of church services and conduct services virtually if possible. 2. Limit those attending church functions to a number that allows persons between 3 and 6 feet of space between persons in a seated group, typically 25 or less. 3. Keep already planned weddings to a limited gathering of a maximum of 10 persons for the ceremony. The reception could be postponed. 4. Postpone or cancel all non-essential social and cultural gatherings. 5. Avoid visiting the housebound members, especially the elderly. In this regard, it is suggested that phone contact would be most appropriate. This will reduce the risk of infecting the vulnerable, sick, and elderly. 6. Limit those attending funerals to immediate family members, that is between 10 and 25 persons. An attendance by invitation only approach can be utilized. And 7. Keep members informed consistently with official, accurate, and up-to-date information. Second heading, event organizers and the general public. 1. Ensure no overcrowding at events and maintain at least 3 feet, 6 feet if possible, between persons. 2. Hygiene and physical distancing must be combined. Shaking hands, kissing and hugging as forms of greeting should be avoided. Consider smiling, waving, or bumping elbows. 3. Keep patrons informed consistently and constantly. 4. Avoid the lunchroom rush if you eat in the employee dining room, cafeteria, or a restaurant. Eat earlier or later, eat at home, or eat when just a few persons in a quiet area. Eat with just a few persons in a quiet area, inside or out. 5. Avoid using public pens at the retail counter, at the building or hotel guest registration, at the bank, in the revenue office, and other public places. Use your own pen. In conference rooms, don't use the public whiteboard markers. Carry your own. 6. Avoid the commuter rush periods. Where possible, you use public transportation. Employers should consider staggering start times for work and allowing work from homes. Avoid times when you will be exposed to crowds. 7. Find a quiet place if you are in a public space, such as a business office or restaurant. 8. Substitute telemeetings for face-to-face meetings and reduce the number of duration of face-to-face meetings. Shift as much of the agenda as possible to email or teleconference. 8. Use large conference rooms if you must meet face-to-face. These recommendations for limiting non-essential contact are guided by scientific evidence and will go a long way to reduce the spread of COVID-19. To date, St. Vincent and Grenadines has recorded one confirmed case of COVID-19. The support and cooperation of all citizens are needed at this time if we are to minimize any further spread of COVID-19. Now, if you listen to television, particularly international news, that is the consistent advice given all around the world. Countries are limiting by law gatherings of persons of more than a certain amount. And this morning I saw an article, Germany tightens curbs and bans meeting of more than 2. So Germany has said no more than 2 people should be together in a public place at any one time. I have a lot of articles I've taken from the internet showing what is happening in various parts of the world. Many countries have closed their borders, no planes in or out. In the Caribbean, the tightening is going on and has gone on. Trinidad has closed its borders to all but Trinidadians. You can't go in to Trinidad unless you belong to Trinidad. The BVI this morning reported that they are closing their borders as well, closing their airspaces. No planes in or out. So that, my brothers and sisters, this is a serious pandemic. Pandemic means an epidemic which is spreading or has spread all parts of the world. There's no place you can go and feel safe from COVID-19. I want finally to plead with the authorities of this country. As quickly as possible, make a decision with regard to Carnival 2020. The last bulletin I read indicated that the government said it was too early to make a decision as to whether Carnival should be banned or not. Well, they haven't found it too early to put off the Olympic Games, and a decision is to be made very shortly because many athletic bodies nationally have called on the organizers, National Olympic Committee, to put off the Olympics. Australia said their athletes are not going. Canada said their athletes are not going. The Japanese government, for the first time this morning, said, well, it is possible that the games could be postponed to a later time because of the situation. Now, our carnival is June, July. People would be ordinarily busy spending money to make costumes and other preparations. The carnival tents would be getting ready to operate. I find it unthinkable that there would be calypso tents and carnival tents going on any time in the next few months. So that it doesn't make sense to me to postpone the decision to cancel Carnival. The decision should be taken as soon as possible. This is not to panic, but it is just to be responsible. And if we go ahead with Carnival, who is going to come to St. Vincent and Grenadines for Carnival? People from North America are not going to come because the government is telling them, if you go and you come back, you have to be quarantined for 14 days. Our people in Canada and England are not going to run the risk to come here for Carnival and only to be quarantined when they go back for 14 days. People in the Caribbean are not going to travel to St. Vincent and Grenadines because every government is telling their people Don't travel unless you have to. So you think people are going to come here in any big set of numbers? So if we go ahead with Carnival, it would be it would be a waste of time. It would be a joke. And the people would have spent a lot of money so that the sooner that you tell the nation what is happening and the sooner you say, look, we have to postpone Carnival, we'll wait and see if later in the year things subside. We could always have the Carnival at a later month. And if things continue to be bad or get worse, we could always postpone the Carnival entirely. We can't put nice time ahead of our national health interests. As simple as that. And I'm sure the people who play Carnival would understand in the circumstances that it is too risky. For one thing, it would be violating the government very guidelines about not having large gatherings. It will make a nonsense of the government plans to hire 40 nurses, which I've seen advertised, to be getting doctors and nurses from Cuba, to be planning a mini budget. These things, when I heard them, I said, well, those are good, sensible measures. Those indicate to me you only have one case of COVID-19 so far. But if the government is planning to do these things, it tells me that the government knows that things are likely to get much worse before they get better. And if you are planning for things to get worse by making advanced plans, then what are you holding up the decision about Carnival for? So that I would urge the government to think twice. Those of us who issue that call, we're not anti-Carnival, we're not panicking. But we're simply saying, logically, it doesn't make sense. You know? Carnival is gathering of people. When people go to Calypso tents and people are gathered in Carnival tents and so on. Those are gatherings that the very guidelines from the government told us to avoid. So I hope the authorities would take what I say in the good spirit in which it was given. It remains for me to wish that we continue to watch and pray. With the Lord, all things are possible, but we have to be sensible and take the precautions which the scientists are telling us we should take. All right? The world is battening down. People are being banned from walking about in some countries. The British Prime Minister, who was reluctant at first and who practically said, oh, there's no big thing, now he is leading the charge to say, let us close down. Britain has closed down the pubs. I never thought I would live to see an institution like the pub in England being closed down. Restaurants have been closed. President Trump, who started by saying, oh, we just have 14 cases and by the end of April it will be all finished. He's now saying, look, the United States is now at war with this virus. So in all countries of the world, people are getting very serious. And we have to demonstrate that same level of seriousness in St. Vincent and the Grenadines. All right? I believe I will continue with the topic next week, Monday, DV4. So for now, that is all from this program 967 of The Law and You. I look forward to being of further service to you next week, Monday, DV, for another presentation in this public service nation-building series, The Law and You. Do have a watchful, sensible, and obedient week. Let us obey common sense and medical advice. avoid crowds, wash our hands frequently, do all the things which the doctors are telling us we should do. Okay? So that is all from the program, from this program, The Law and You. May the good Lord continue to bless us all.
The Law and You, a look at laws in St. Vincent and the Grenadines which affect our daily lives. The Law and You, presented by lawyer panel P.R Campbell QC and brought to you on SVG-TV as a public service.